Hello, my name is Mary Cloud, Assistant Director for Riverbridge Regional Center. Today, our interview is with 3 medical forensic nurses that Riverbridge contracts with. With us, we have Becky Antonelli, Angie Hildebrand, and Kelly Hill. They are here with us to explain the medical services we provide to our clients here at Riverbridge. Welcome, ladies, and thank you for being here.
Marianne.
First, I would like to start out by having you introduce yourself, your role and time at RBRC. And Becky, why don't we start off with you?
Sure. My name is Becky Antonelli. I'm the clinical coordinator for Mountain West SANE Alliance, which is a subdivision of Riverbridge. I have been a registered nurse for 12 years now, 3 of which have been at the last 3 have been with Mountain West SANE Alliance in Riverbridge. I work there part-time. Otherwise, I work full-time in the ER at Grand River Hospital, where I'm a certified emergency nurse.
And I'm Kelly Hill. I am a forensic nurse working at Riverbridge as well as Mountain West SANE Alliance. I've been with Riverbridge for 7 years now, a little over actually. And my other role, I've been a nurse longer than I like to think, and have just worked in so many different areas of nursing, primarily inpatient and a little more of the outpatient role in more recent years.
And I'm Angie Hildebrand. I'm one of the 2 pediatric sexual assault nurse examiners that work at Riverbridge on a regular basis. So I work with Kelly. And I've been a forensic nurse examiner for almost 3 years, and I've spent about half of that at Riverbridge. Outside of this field, I've been a nurse for 16 years, most of it in women's health, both inpatient and outpatient.
Well, thank you, ladies, for being here and being such a great part of the Riverbridge team. Now, I would like to start out with the important question, how is sexual assault defined? And how does consent play a role in how sexual assault is defined?
Well, in the state of Colorado, sexual assault is defined as a knowing act of unwanted sexual penetration or intrusion committed when it's against the victim's will, if the victim's incapable of appraising the nature of his or her behavior or conduct, if the victim submits erroneously, believing that the other person is, say, their spouse, if the victim submits to the coercion of someone, if it's committed by someone purporting to offer a medical service or medical purpose or in a manner substantially inconsistent with reasonable medical practices, or if the victim is physically helpless and has not consented and the person having sex with him or her knows this. So what is consent? Then consent is, sexual consent is where a person has the ability and the freedom to agree to sexual activity. Sex without consent is rape. It is sexual assault. Does that make sense?
Absolutely. Thank you for those specifics regarding with the state of Colorado.
Sure.
Now, what is a SANE nurse and how does it compare to an RN nurse at a hospital?
So SANE, or Sexual Assault Nurse Examiner, is usually a registered nurse who has additional training and education to be able to care for patients who are victims of sexual assault. As a forensic nurse examiner or a sexual assault nurse examiner, we have competency in conducting medical forensic exams that may or may not include evidence collection. We have the expertise to provide expert courtroom testimony. And first and foremost, we demonstrate compassion and sensitivity when dealing with survivors of sexual assault. So we're registered nurses with additional training in order to take care of people who have been through an assault.
Thank you for that clarification. Now, can you explain what is a SANE exam and how long does it take?
Sure. So a SANE exam is used for the medical diagnosis and treatment of a patient who's been assaulted. So the medical well-being of the patient is our primary objective at all times during the examination. We also can treat possible infection or help administer pregnancy prophylaxis. We make referrals to counseling and other follow-up services, advocacy, and then depending on the details and the timing of the assault, we may collect evidence to be submitted within an evidence kit that would go over to law enforcement following an assault. So that kind of determines case by case, each patient, each exam is tailored to that patient. So the exam length can take a few hours. So it's very detailed, very specific, again, very tailored to the patient. So anywhere from 2 to 5 hours, depending. We first obtain consent from a patient, then we move into a medical history that helps direct our care. We then administer a full head-to-toe examination, including examination of the genital area. And then depending on the situation, we may or may not collect evidence. So very thorough, very patient-specific, but it can take a long time.
And knowing that some of our clients are coming from far distances, we cover Eagle, Pitkin, Garfield, and Rio Blanco counties, that often might be the reason why sexual assaults do not get reported or exams get completed, that length of time that it takes. But how important are these exams, not just for the evidence collection that you said, but for one's health? Kelly?
So these patients are 100% at risk for significant health problems across their lifespan. Not only mental health issues such as PTSD, they are at highest risk for suicidal ideation, depression, as well as the physical issues that you might not necessarily correlate with a sexual assault or a interpersonal violence or sexual violence situation. Obesity, unplanned pregnancy, even diabetes, heart disease, issues like that. This is a problem throughout the lifespan, and so we really want to see patients early on to get those referrals made and assess for those risk factors, treat any injury that they might have, reassure them that if they do have injury, it's going to heal. They're not, especially with children, they might be concerned that they're damaged, that they're different than their classmates and their friends or their peers. So we want to reassure them that they're not different, they're not damaged, they're not broken, that they are going to get through this, that they are on a path to healing, and that it really can start with that exam. And just providing all that support, those medical and healthcare referrals, those mental health referrals. It's really a holistic process. It's a head-to-toe exam. It's a mental and physical assessment that we provide. And there's just a focus on that patient, and like Angie said, it's very specific. Like Becky said, it's reinforcing that it's not their fault. Nothing that they did prompted a sexual assault, because those feelings of guilt can be so prominent. So it really is trying to tackle that patient as a whole, but also anticipate problems that they may have down the road, and make those referrals and provide that education.
Well, thank you for the support and the compassion you show our clients when they come in for these delicate and often difficult exams. Does every child get a SANE exam?
If they want one. So yes, I mean, that is offered to all families who come to River Bridge. And it should be offered to all adults as well. It doesn't always happen, but at River Bridge, we offer that to every family and child if we're speaking to them individually.
Good. Now, how young can a child be for a SANE exam to be completed?
We see all ages of kids at Riverbridge. So again, it goes back to what Kelly is saying. Obviously, there's at a certain age, a kid can't verbalize whether they're okay with an exam, but certainly we try to seek assent from kids rather than consent. They're not of legal age to do so. But we provide that service if the parent and the child are willing.
Well, good. Well, thank you so much for your thoughts and your information and knowledge about medical forensic exams. Do you have any final comments?
I've got one. It's just a little public service that rape happens to all genders, all sexualities. About 92%, excuse me, of victims are female, 8% being male. Most rapes occur between people who actually know each other in some way. And again, I'm going to reiterate what Kelly said. Nothing a victim of sexual assault did, wore, said, went, nothing that they did caused them to be sexually assaulted. Someone is sexually assaulted because someone wanted to sexually assault them.
Thank you for that very important message that I know a lot of people really need to hear on a regular basis. Well, thank you, ladies, for your time to speak with the community and share your experiences. Thank you, friends and supporters, today for taking the time to meet with the Riverbridge team and understand the services that we provide to the community. If you have any questions, please reach out to us at info@riverbridgerc.org. Have a good day.